In a few minutes, I think we can get started. Thanks everyone again for joining today's virtual office hours. In today's session, we're going to do a brief history of the dashboard, and then we'll do a site walkthrough where we'll dive a little bit into the data. My name is Dana, and I am a research analyst with the Congressional District Health Dashboard team. I'm going to be joined today with a couple of other members of our team, including Avalon and Hannah, who will be helping me monitor the chat. So throughout the session, if you have any questions, feel free to put them in the chat. At the end of the session, I'll also do a live Q&A, and you can come off of mute at that time, and we can answer your questions then as well. So we can just dive right into it in our little history. Okay, so rigorous and nonpartisan data on health and the conditions that affect health were not widely available at the congressional district level. And so the Congressional District Health Dashboard was launched in January of 2023 to address this challenge. And it's become our mission to provide this type of data for our users. And the idea here is that it's also our goal for our users to have this data so they can use it to drive change at the local and the state and the national level. And so data itself, can't change policy, but it's an important facet in doing so. Data can be used to illuminate the challenges and assets in communities that might have been hidden. It can be used to inform effective policy solutions and can also be used to hold leaders accountable. The data on our site can provide information that can support data-driven decision-making. And so we built this tool really for a wide audience. So think like elected officials and their staff, advocates, journalists, really anybody who has an interest in district level data. And we built this tool off the success of our City Health Dashboard that was launched in 2018. Our team is housed in the NYU Grossman School of Medicine's Department of Population Health. And some of our partners include the Robert Wood Johnson Foundation, the Bipartisan Policy Center, and the Center on Budget and Policy Priorities. And so the big question is, what do we measure? So on the Congressional District Health Dashboard, we have a total of 37 metrics that fall under 5 domains that you can see here. So the first domain is health outcomes. So think measures like frequent mental distress and obesity. The other domain of social and economic factors. So think broadband and unemployment. And the other domains are health behaviors, physical environment, and clinical care. And you can see the metrics that fall underneath here on the screen. So for any of the metrics that you see have like an orange star, that indicates we have the demographic breakdowns available. So think sex, race, ethnicity, and age for where it's available. And for the metrics that have the green triangle, we do have the census tract level or neighborhood level data available. And so all of the metrics on our site is drawn from federal sources and other data sets that adhere to rigorous standards of data collection and analysis. So think the US Census Bureau, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. All of the measures on our site aim to be actionable and reflect public health priorities. And our team of population health and policy experts, epidemiologists, and geospatial specialists, we regularly update the site with new data as they become available. We also try to add new measures where we can that balance over the 5 overarching domains that we talked about previously. And that's a little bit of our history. So now I can pause and see if there's any questions in the chat as I move to our site walkthrough. So this is the Congressional District Health Dashboard's homepage. And on this page, you can enter an address if you don't know what congressional district you're looking for specifically, or you can type in one that you know of that you want to look at. So you can do a state or a district here. So let's say I want to look at Minnesota's 5th district. So once you put that in, it brings you to the first section of our site, which is the Health Snapshots page. And here there's two parts to that. The first is the metrics overview that provides all the metrics and the estimates in that geography that you selected at a glance, and also the district facts. So this provides just some information on the population that's in that geography. So think the age, race, and ethnicity breakdowns. This is a newer feature that we actually added on the site just a couple months ago. It includes all of the cities that are in our sister site, the City Health Dashboard, that fall within the congressional districts that you selected. So here you can see that Minneapolis and St. Louis Park are 2 cities that we have in the dashboard that fall within Minnesota's 5th. So when you hover over that, you can see that outline in the map in blue. you can click on that, and it brings you to our City Health Dashboard site. And so this might be particularly helpful for folks who might be looking at cities and wanting to look at the metrics estimates for a city that's homed within a larger congressional district and wanting to compare how that looks on the congressional district that's at large. We also include some congressional representation, so both on the House and the Senate level. And that's all for district facts. Navigating back over to our metrics overview. So as I mentioned before, this is a good page for you. You can see everything at a glance, all of the estimates and the comparison to the US average. So you can see that we have a yellow triangle here. And on this left-hand side, you can see that that indicates an instance where the metric estimate for the geography that you selected is doing just around the US average. We use a red square for instances when the estimate's doing worse than the US average, and a green circle for when it's doing better than the average. We aim to be like really navigable and easy for our users to use. So you can actually filter by the domain here and even bring down, drop down the menu to select specific metrics you might be interested in. So, if you're interested in maybe like education and children health, you might select teen birth rates, maybe some frequent mental distress, children in poverty, high school completion, and it'll filter out to that. We've also added a feature here that you can click on to print the page. So it'll print this page as is, including the stuff that you've kind of filtered out if you use that filter function. And you can, that might be helpful for you so you can have on hand. So let's see, children in poverty here, you can see is just doing about the US average. If you are interested in looking into children in poverty even further, you can click on this metric directly, bringing you to our second part of our page, which is metric maps. So we provide kind of two different ways to look at this. We provide a scale bar at the top and then also a map at the bottom. So for all across our site, when you see lighter purple, that means there's better outcomes. And when you see a darker purple, that means poorer outcomes. So in this case, you can see that Minnesota's value estimate here is, as a state, is 10.9%, and Minnesota's district is 14.4%. So you can see that Minnesota's fifth is doing a little bit lower than the state average. On this left sidebar here, you can also change the geography of interest, the metric time period for when we have more than one available, and change the comparison value back to the US average or vice versa for the state value. So, I mean, just flipping it back here, you can see that the United States average is actually worse than Minnesota's fifth. So it was 15.9% of children in poverty in 2022. For this metric in particular, we do have the neighborhood level or census tract data. So you can click on show census tracts and it will show you how that breaks down on like a more local and granular level. You can also click on this little tab here. It says census tract values. So if you knew exactly what census tract you're looking for, you can type it in and click on that. It'll hover and then highlight it in blue. So that might be helpful if you, wanted to click on, see more specifically what census tract the estimate is, where it is on the map. So yeah, this is helpful just to see how that breaks down and how the average in Minnesota's fifth district for children in poverty looks across. So, you see here that there's kind of poor outcomes like darker purples, and then kind of over here and like above here, there's just like areas that are much lighter in purple. So it's good. A good way and different way to visualize it. You can download the images, so you can download the map or the scale bar here as well. And this metric also has demographic breakdowns available. So you can scroll at the bottom here and click on this tab, and it'll bring you to the next section of our site, which is the metrics by demographics page. So if you wanted to just see children in poverty more, like dive into it a little bit more for Minnesota's fifth, you can click directly on that and it just brings you directly to the next part. So here you'll see the breakdowns for race and ethnicity for children in poverty in Minnesota's fifth. And then our other section of the site is the compare districts feature. We've actually added this feature also more recently, just about a few months ago. And you can put in, a variety of different comparators. So at the default, the top is the scale bar for the United States average, and it's a point of comparison. Then you can add in other, anything you were looking for to compare. So if you wanted to do like Minnesota's first and second, all the scale bars will show up at the top, and then all of the cards will also appear at the bottom and showing you in like the map view for that metric that you picked. And again, you can also, go in here and change the metric just so it's navigable and users can flip through based what they're interested in. I think my site has frozen. What happened there? Okay, so that is all that I want to show for the compare districts. And another thing that we provide for our users is the metrics background. So if you wanted to know a little bit more as to why we measure it, how we measure something, the calculation, the data source, and et cetera, you can go onto this page and click on any of that, and it'll provide more information on that metric. And again, one of our main tools on the dashboard is that all of our data is easily accessible where users can download it, view it, and et cetera. So in our hamburger menu at the top, you can see we have an access the data tab. So all of our data is completely free for users as long as you have Wi-Fi. You can click on this and after filling out a brief survey, it brings you back to this page actually, where users can dive into it and download the data. We provide a codebook and a technical document for users to support their data analysis. And yeah, that's all that I had for this site walkthrough. Any questions in the chat while I'm on this site walkthrough?
No questions.
Great, thanks, Avalon. So I'm just going to navigate back to our slides. So that is pretty much all that I had for today's session. We did the brief walkthrough of the site and also did the history before. So you can stay tuned. I will send a recording of this virtual office hours and also the slides. And I'll also send a brief survey. So you can fill that out if you wanted to provide some feedback for us. But other than that, feel free to stay on. We'll be on to answer some questions. Send us an email, like let's stay connected through LinkedIn or through our X. Thanks everyone again for joining.